Before I say a single word about medicine, do something for me. Clear your throat right now, just once. Notice what you felt at the back, that thickness, that coating that won't sift no matter how many times you try today. Now, think about how long it's been there. If you are watching this, I would guess it isn't days, it's weeks, maybe months, and you have probably blamed it on your COPD, your asthma, or just getting older, and been handed another inhaler and sent on your way. Here is what you actually need to know, that the mucus is not random. And in my experience, at least one of the reasons it won't sift has nothing to do with your lungs at all. One of them is a tablet millions of people take every single day for something completely unrelated. I am Dr. Suman Pon, an NHS and private respiratory consultant here in the UK, and I have spent 15 years watching the same pattern repeat in my clinic. A COPD or asthma patient clearing their throat constantly, waking with a chest full of mucus they can't sift, told to increase their inhaler. Nothing changes. And when I actually sit down and investigate, not just manage, but investigate, I almost always find the same thing. Multiple causes stacked on top of each other, most of them never once looked for. Quick disclaimer before we go further, I'm a doctor, but I'm not your doctor. This video is for education only. If you are struggling to breathe at rest right now, call 999 and drop a comment for me now. Is your throat clearing worse first thing in the morning, or does it stay with you all day? Type morning or all day. Your answer actually tells me a lot about what's driving this. The first cause is the one I want you to pay closest attention to because it's the most frequently missed. It's called laryngopharyngeal reflux, silent reflux. Most people know heartburn, that burning in the chest after a heavy meal. But there is a quieter, far more deceptive version. No burning, no obvious indigestion at all, just a throat that won't settle and mucus that's worse the moment you wake up. Here is what's happening. There is a muscular valve between your stomach and your foot pipe whose only job is to stay shut after you eat. With age, it loses the tone, like a rubber band stretched one too many times. And when it doesn't close fully, stomach acid travels upward, not just into the foot pipe, but all the way to your throat and airways. And even a microscopic trace of acid reaching your airways triggers your body to pump out thick protective mucus to coat the irritated tissue. In a healthy person, it clears quickly. In a COPD or asthma patient, it pulls, it sits, it coats the back of your throat every single morning. And in asthma, that acid can even trigger airway narrowing that feels like an attack but won't respond to your reliever. Because the trigger isn't an allergen, it's acid you can't feel reaching your lungs while you sleep. Now, silent reflux is one thing, but there is a second cause hiding in plain sight, and this one is almost always treated the wrong way, with something you can buy over the counter that actually makes it worse. The second cause is postnasal drip. When people think sinus problems, they picture intense facial pressure and a blocked nose. But in many people with COPD and asthma, chronic sinus inflammation is almost invisible. No dramatic headache, just sinuses that are mildly swollen, producing a little extra mucus, draining silently down the back of throat all day, every day. And that does two things. It adds a constant mucus load to airways that are already struggling to clear what they have. And it acts as a physical irritant that keeps triggering your cough reflex. Here is where people go wrong. Most reach for antihistamines from the pharmacy, and there is a reason that almost always disappoints. Antihistamines dry the mucus temporarily, but they do nothing for the inflammation causing it. And dried, thickened mucus in compromised airways is more dangerous. Not less, it plugs, it blocks, it invites infection. The approach with the strongest research support is simple, cheap, and needs no prescription. Daily saline nasal irrigation. It's effective, safe, and low cost. The single most important word is consistency. 2 full weeks of daily use before you judge it. Most people quit after 2 days and say it didn't work for them. If this is already making more sense than your last appointment did, that's exactly why I make these videos. Subscribe because I break down complex respiratory problems in plain English. I also run a free lung health community with a weekly newsletter. The link is in the description box below. Now, here is cause number three, and this is the one that surprises people the most because it's causing real measurable harm that's being blamed on worsening lung disease every single day in GP surgeries across the UK. And it's likely sitting in your kitchen cupboard right now. Your blood pressure medication. There is a class of blood pressure tablets called ACE or ACE inhibitor, prescribed millions of times a year in the UK. They are effective and for many people genuinely important, especially those with heart condition alongside their lung disease. But they carry a documented class-wide side effect. They work partly by blocking the breakdown of a substance called bradykinin. And in a large number of patients, studies report between 5 and 20% that buildup triggers persistent throat irritation, a constant urge to clear the throat, and a dry cough that doesn't respond to any respiratory medication. Because it isn't a respiratory problem, it's a drug side effect. Here is why it's missed so consistently. The side effect can take weeks or even months to appear after starting the tablet. So a patient starts one 8 months ago, their throat symptoms start 6 months ago, and neither they nor the GP connects the two. The cough gets blamed on COPD, the mucus gets blamed on asthma, the inhaler dose goes up, nothing changes. One study of over 27,000 patients found adults over 65 had a 53% higher chance of this side effect. Common UK names are ramipril, lisinopril, perindopril, and enalapril. If one of those is on your prescription and you have a persistent cough or throat mucus, that's a conversation to have because there is an alternative class called ARB that controls blood pressure just as well without this effect. Do not stop your medication on your own, but do have the conversation with your GP. Type ACE in the comments if you are on one. I want to see how many of you this reaches. That was a medication most people never suspect. But the fourth cause is the opposite. It's something so simple people dismiss it entirely. And yet, for a COPD or asthma patient, it's directly linked to your risk of a flare up. Cause 4 is dehydration. Your mucus is mostly water, and its consistency, whether it's thin and easy to clear or thick and sticky and impossible to move, depends directly on how hydrated you are. Think of fresh honey versus honey left open overnight. Same substance, completely different behavior. And in compromised airways, thick mucus doesn't just sit there. In COPD, it becomes impossible to cough up, leading to mucus plugging and is a direct route to chest infection because bacteria thrive in one static mucus. In asthma, mucus plugs are one of the primary mechanisms of severe attacks. This isn't a minor inconvenience, it's a genuine physiological risk. And here is a trap for older adult. Your thirst signal becomes less reliable with age. You can be dehydrated enough to noticeably thicken your mucus without ever feeling thirsty. A practical target used in clinical nutrition is roughly 30 mils per kg of body weight a day from all sources. Water, herbal tea, soups, water-rich food all count. This does not apply to you if your doctor has advised fluid restriction due to medical reasons. The key is steady, deliberate sipping through the day, not catching up in the evening. Be honest with me. Type Yes, if you know you don't drink enough, you are not alone, and it is one of the most fixable causes I see in clinic. That brings us to the fifth cause, and this is the one almost never mentioned in a respiratory appointment because for many patients, part of the root of their airway mucus isn't in their lungs at all. It's somewhere completely different. And years of a very common, a very necessary treatment may have quietly made it worse. The fifth cause is your gut. Your digestive system and your respiratory system share regulatory pathways through your immune and nervous system. The trillions of bacteria in your gut, your microbiome, directly influence how inflamed and reactive your airways are. When that balance is disrupted, a state called dysbiosis, it activates immune responses that promote mucus overproduction in the airways. This connection, the gut lung axis, is one of the fastest growing areas in respiratory research. Studies, including work published in the American Journal of Critical Care Medicine, confirm that gut microbiome disruption drives airway inflammation. Now, here is why this matters, especially for COPD. Think about the typical journey: a chest infection, a course of antibiotic, recovery. Another infection, more antibiotics. Some of my patients have had 6 or 7 courses in a single year. Every course, while genuinely necessary, disrupts the gut microbiome, wiping out beneficial bacteria alongside the harmful ones. And when that happens repeatedly, the inflammatory signaling to your airways never fully settles between courses. This is not a reason to avoid antibiotics when you truly need them. It's a reason to actively support your gut, something almost no respiratory patient in the UK is ever told to do. So now you know all 5 causes, but knowing them changes nothing unless you act. So here is exactly what to do starting tonight. Stop eating at least 3 hours before you lie down. One of the most evidence backed steps for reducing overnight silent reflux. This week, check your medication list for ACE inhibitors. And if you are on one and you have a cough, use these words with your doctor. Could my blood pressure medication be contributing to my respiratory symptoms? And is there any alternative option for me? This week, get a nasal rinse from the pharmacy. Use once every morning for 2 full weeks before you judge it. Starting today, set hydration reminders and aim for that 30 ml per kg target. And this month, support your gut with one small daily serving of a fermented food, plain live yogurt, caffeine, or some probiotics. Now, you know exactly why that mucus won't clear and what to do about it. But for a lot of my patients, the mucus isn't the only thing they have been putting up with. Breathlessness that gets worse every month, and their GP keeps changing their inhaler. Sometimes the lungs aren't even the problem. Check out this video where I show you the 5 clues I use in clinic to find out what's really causing your breathlessness before it gets serious. See you on the other side.